Well, so we've had another 2 weeks added to the current level for lockdown restrictions, but the infection rate just keeps getting higher and higher. Clearly, something is wrong with the approach. Wits University Professor Laetitia Rispel has written a piece titled "Spike in COVID-19 Cases Points to Gaps in South Africa's Response." She joins us now to help unpack this. A very good evening to you. How have we got it so wrong?
Hi, good evening, Jane, and good evening to the viewers. Jane, we have, with the COVID pandemic, we have an absolute emergency. And one of the key issues is that there has to be strong central leadership. As you know, the Constitution makes health a concurrent competency of both the national government as well as provincial government. But we have the National Disaster Management Act, which actually makes provision for the National Department of Health to provide leadership for the entire country. So we've seen very varied responses across the 9 provinces. Gauteng and the Western Cape and KwaZulu-Natal have large urban areas. Gauteng is functionally urbanized. And so here we have a lot more resources in this province and in the Western Cape, and certainly in the urban parts of KwaZulu-Natal compared to the more rural provinces. But we've seen largely a very fragmented response that's been driven by the individual provinces. Of course, we have national laws and national regulations, but it's been the response to the pandemic has been very fragmented, and it's largely been a provincial-specific response. And
I guess you're not surprised, though. I mean, we don't have enough medical workers, frontline workers in this country anyway. We've seen that playing out now. When it comes to dealing with the pandemic, we've lost the health minister, and we've got somebody running it who's not even a doctor. It seems that when it comes to this, it's not been taken seriously enough.
It's difficult to say, Jane. Certainly, when you see the actions and the activities, there's quite a lot of activities, And if you look at the very good leadership provided by the president, but of course the president can't run the health, the health system, and so we do have a problem. It's from a political point of view, it's not necessarily important that you have a health professional who's a politician. And so the issue that the current acting health minister, is not a doctor or a health professional, that's not necessarily the key issue, because the response should really be driven by the public servants who are appointed and, in high positions, in executive positions. They should be the ones that actually determine the strategy and the response, and ensure that there's some uniformity of execution or implementation.
I was reading your writing, and you were just saying that the problem is that you shouldn't even get to hospital in the first place. So people don't understand the sort of interventions that they must stick to, and they are not convinced that they need to go through the necessary protocols in order to not get infected.
Yes. So for example, Jane, one of the key issues early on, and in about probably May, we could see in this province of Gauteng that the early warning system already said that some of the numbers were going up, and that there were certain hotspots. And one of the hotspots, for example, was in Sedibeng, in the Vaal area. And, there were, of course, appeals to people to kind of stay with the non-pharmaceutical measures. But our vaccination program, of course, there were a number of externalities that we didn't have control over, such as the Johnson & Johnson vaccine. But certainly our vaccine program started off very slowly, and people continued with their lives. And certainly we had, if you remember, in May we had the regulations at the time, we were at level 1. It stated that with funerals you could have 100 people inside, 250 outside, similarly with large gatherings. And my sense is that there was very little compliance with those regulations. And so we had almost the perfect storm from a kind of community spread of the virus point of view. So early on, we should have taken action. We should have ensured that people understand the reason why there should be these non-pharmaceutical measures, such as hand washing, physical distancing, wearing a mask, keeping to small numbers, not having super spreader events. Because not only did we have these relatively large numbers of people that attended funerals and other social gatherings, but in many instances they didn't comply then with those protocols. So I argued for both an early response, actually looking at the data and taking action as a result of what you see from the data. So to use the data for decision making. I also argue that there has to be a partnership almost between government and communities. So that
that's so incredibly important, isn't it? Excuse me jumping in here. I mean, you also talk about the failure to deal with concerns and fears of frontline workers, and those workers are so important to us. I'm afraid we're going to have to leave it there. Laetitia, Rispel, thank you for talking to us.